These graphs speak for themselves. Deaths before and after jabs. You can see the exponential growth of deaths in these countries. It is utterly shocking and terrifying. Citing data from the country's health insurance database, 3 universities in South Korea have revealed that the fully vaccinated are much worse off health-wise than the unvaccinated. In this video we will show the data they found that proves blood, skin, bones, eyes and ears all damaged by COVID jabs. One study they put together looked specifically at musculoskeletal disorders like injuries or disorders of the muscles, nerves, tendons, joints, cartilage and spinal discs. Wuhan coronavirus, COVID-19, vaccines, the researchers found, are directly linked as a significant risk factor for every kind of inflammatory musculoskeletal disorder. After looking at the COVID jabs manufactured and sold by Pfizer, BioNTech, Moderna, Janssen, Johnson & Johnson, Novavax and AstraZeneca, the researchers determined in a cohort study that people who take any of these shots have a much higher risk than people who don't of developing inflammatory musculoskeletal disorders. Lead author Dr. Ji Hyun-soo from the Department of Rehabilitation Medicine at Ifa Women's University evaluated incidence rate and risk in numerous areas of medicine including gynecology, reproductive system disorders, hematology, blood disorders, dermatology, skin-related disorders, ophthalmology, eye-related disorders, otology, ear-related disorders, dental problems. For all of these, Dr. G found that vaccination in general significantly increases one's risk of all of these diseases in their non-fatal form, with the risk of inner ear disease being the highest of them all. One very common complaint among the fully jabbed is that after doing the deed, patients report tinnitus, or ear ringing, as an adverse effect. Tinnitus is already well known to be a side effect of other pharmaceutical drugs such as antibiotics, antidepressants and anti-malaria medications. Blood disorders are also a common adverse event stemming from COVID jabs. Researchers looked at data on some 4.2 million people to determine that post-jab abnormalities include decreased production of red and white blood cells, as well as damage to bone marrow. These include nutritional anemia, which is iron deficiency, hemolytic anemia, when your red blood cells are destroyed faster than they are replaced, aplastic anemia, a rare condition that stops the body producing enough new blood cells which usually develops because of bone marrow damage, coagulation defects. The most common is VITT, the ex-account of Sally Beck, a rogue legacy media journalist, and vaccine injury whistleblower, reports. Neutropenia, which is an abnormally low count of white blood cells called neutrophils, is also caused by damage to the bone marrow. Neutrophils help your immune system fight infections and heal injuries. Regardless of whether someone takes an mRNA, mod-RNA, injection series from Pfizer BioNTech or Moderna, or one of the viral vector shots from Janssen or AstraZeneca, the risk of coagulation defects increases regardless. As for inflammatory musculoskeletal disorders, Korean researchers looked at data on some 2.2 million people to learn that a wide range of problems in this category stems from getting jabbed for COVID. Getting jabbed for COVID increases one's risk of plantar fasciitis, a painful condition of the foot in the soft tissue connecting the heel bone to the toes, rotator cuff syndrome, adhesive capsulitis or frozen shoulder, herniated intervertebral disc or slipped disc, spondylosis, a term used to describe osteoarthritis of the spine, bursitis, inflammation of the cushions at the joints, Achilles tendonitis, de Quervain tenosynovitis, a painful condition affecting the tendons on the thumb side of the wrist. In conclusion, all COVID-19 vaccines were identified as significant risk factors for each inflammatory musculoskeletal disorder. This study found individuals who received any C-19 vaccine were more likely to be diagnosed with inflammatory musculoskeletal disorders than those who didn't. Like the video, share the video, subscribe for more news updates and mind-blowing content. Have an extraordinary day.